The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to another edition of Humanity First. My name is Peter Evers, the host of the show, and today we're going to talk about politics, and so please don't turn off. I think one of the things that really worries me about politics is that there's a cynicism that has been curated, I guess, over the last few years, maybe over the last 20 years, that nothing ever happens in politics, and there are two sides and they're so far apart and things that never get done. There's some truth in that. But today we're going to have Maryann Mulligan from Governmental Strategy. She is a lobbyist and consultant that works with BAMSI, and she is a magician when it comes to getting resources and helping us get resources for vulnerable populations. For instance, funding for early intervention programs, things like that. We're going to talk about three issues that are on everybody's mind at the moment, and we're going to explore what's going on at the State House. What is the State House report relative to housing? There's a huge problem that is affecting everybody in this state. What is going on relative to education? We've had some issues locally in Brockton, but is that really, a cameo of what's going on in the rest of the state and the country, indeed? And then finally, closer to home for BAMSI, what's going on with substance use and mental health in the wake of COVID, and as the dust settles with kids who are back at school and those years that have played a toll on kids' childhood. So we'll be exploring what the bills are that are going on at the moment and the amount of money that is being committed to those three issues and how that's going to help in the future. So Maryann Mulligan will be on next, so we'll be right back. Thanks.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse, and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Well, welcome back, everybody, to Humanity First. And as promised in the first section, we have Maryann Mulligan with us, who is our lobbyist here at BAMSI, and your company is Governmental Strategies. I know that we have three issues that we're going to talk about today. We're going to talk about housing, we're going to talk about mental health and substance use, and we're going to talk about education as promised. But I thought it would be really interesting, Maryann, just to kick off by saying, what does a lobbyist do? Because sometimes the way that Washington talks about lobbyists, there's a sort of negativity, not a stigma, but a bit like, well, these lobbyists. But I can't tell you how important it is to have somebody who has integrity and who is a lobbyist and who understands the language of what goes on down at the State House. So can we take a minute or so just to talk about the everyday life of a lobbyist, maybe?
Sure. Thanks so much again, Peter. So I am a legislative consultant and lobbyist for BAMSI. And in that role, and we use an analogy because, as you said, most people don't know what do lobbyists do, and what they've heard isn't great. So we liken ourselves to Sherpas, if you've heard of that analogy.
Yep.
So they help climbers, through the Himalayas and tough terrain and everything. What Sherpas have that I think lobbyists, or at least this is how we view it, is, as you said, we understand the language. What are they talking about on Beacon Hill? How does that relate to BAMSI and the services you provide to persons served? We know the culture, and we can help translate all of that to our clients like BAMSI. And we really work in partnership because a Sherpa doesn't do the climb, the hiker does, but they help them.
Right.
And that's the big difference that we say to our clients. You don't hire us and say, go do the work for me. We do it with you. So we're providing our expertise on the process, legislators, how it all works. You bring your expertise. What does BAMSI do? And then we educate legislators and the governor and state officials about that. So we're really that in between, that helper that helps you to talk to each other and figure out, how do we get things done?
Right.
How can BAMSI advance, whether it's a budget item, legislation, and how do you navigate that process and come out with a good outcome for the people that you serve?
Right. So in many ways, you're a civics lesson, right?
Yes.
Because we have, and we compete against a lot of different people, not only within our own world of human services, but I would imagine and I never will be an elected official and never have been, but I can't imagine what it's like. You come into work and every day there's, the plumbers convention that are here asking for better rates for plumbers or whatever it might be. But we need to stand out in the crowd, right? We provide services for vulnerable populations. My thinking is, well, why don't legislators get that? Because this is my life. This is what I'm steeped in on a day-to-day basis. Part of it is really making sure that they're educated, as you said before, isn't it? And understand how a disability, for instance, affects the entire community. And in a state like Massachusetts, which I'm very proud to be a member of, we do pay attention to these things, and we hold that in a very high regard and value, that if you're a member of the Commonwealth of Massachusetts, you have equal rights and everybody should have a fair shake. And I am very proud to be working in an environment like that. Sometimes it takes a little persuading and educating, though, with our legislators, right?
Absolutely. And persistence. I would add that too, because as you said, there's no shortage of worthy causes, worthy people to serve and help. But if you are serving a vulnerable population and you do a great job and you communicate the needs, that's when legislators, the governor, the administration listen, and they really want to know, they want to help, and they want to use state dollars in a really cost-effective way to help the people that need it the most. So that's what I say to folks is, don't be discouraged if, like you said, why won't they fund persons with disabilities? Why aren't we right at the top? You probably are, but then there are homeless people. People who don't have enough food insecurity. Yeah. So the list just goes on and on.
Right.
And so that's why I say your job is to educate, be persistent, and make sure that your voice is being heard in the best way possible, and stay positive. You can't let little bumps in the road deter you from that cause, because people are counting on us. They're counting on us to try to get the resources they need or pass the legislation that's going to make their lives better.
Yeah, and I think, one thing that's really important that I hope people realize is that their voices in a democracy are really important. You might not think there's a great deal of cynicism. One politician said to me that one of the biggest threats to democracy is cynicism in the system. But one call to a legislator is worth much more than one call, right? Because it really does raise the issue. So as we talk about this and we think about the issues that are important to us, calling your legislator is a really important thing to do. To be part of the democratic process.
Absolutely. I always say to folks that I'm working with, my clients, others, decisions will get made with or without you.
Right.
So it's better to have them made with you and with your input. And you're absolutely right. Most people are cynical and they sit back and then just complain that they didn't fund this, they aren't doing that, why? Whereas if you weighed in, you would get a response back. You'd have a sense of what's going on and the process, and then be able to understand this is why it's not happening now, but it might happen later this year. It gives you context and information, and at least you feel, I believe, empowered.
Yeah,
a bit empowered.
If anybody's ever given testimony, it is an incredibly empowering thing. You feel like, I've had my say, and you might be a little concerned that people aren't listening, but you've had your say, and it's really important. And in the end, you're right. It might not happen today, but it happens down the road. So let's just go back to what I talked about in the opening section. Let's take three things that are on everybody's minds at the moment. As I mentioned, the issue of housing is something that is really on everybody's minds at the moment. I guess it's not on the minds of people who don't want to move, who have low interest mortgages that are 20 years old. But, when I think about young people coming into the housing market, when I think about the working poor, when I think about staff who work about BAMSI, this is a huge issue. So I guess the question I have from you is in this sort of State House report is, what's going on at the State House relative to these issues? So it's housing, it's substance use and mental health, obviously, because these are things that are on people's minds, especially post-COVID. And then finally, education, because there's so much going on, and certainly in and around Brockton, it's on everybody's mind. So let's maybe start with housing, because housing is such an issue that sort of affects everybody. Now, we have an unhoused population in the Brockton area, and we're doing everything that we can to address that. There are so many differences of opinions, and I think we've sort of talked about that a lot. But let's talk about the fact that Brockton is what I think is known as a gateway city. It is a city that welcomes new Americans and immigrants, and has always been somewhere that's affordable. It's not anymore. What are we doing at the State House to address this issue of a significant part of the population cannot afford to do what most Americans see as their birthright, if you like, to own a home and to live in a home and raise children?
Right. And especially in a community maybe where they grew up and their goal was to live and work there, and they're finding that impossible. The good news is the Commonwealth, the governor, the legislature fully understand the scope and depth of the housing crisis. It is a crisis. There isn't enough housing in Massachusetts, across our country. We're hearing about this in other states, but let's focus in here. So what they're doing, because they're hearing from employers, they're hearing from people that can't get a house, that are stuck renting and feel like I'll never be able to afford a home. So what they've done is passed the single largest housing bond bill that we've ever seen in the Commonwealth. $5.1 billion with a B to be spent over 5 years. So they always do bond bills over 5 years. There's a good reason. It takes a long time to develop housing, right? To get it from point A all the way to an actual unit or home that someone can move into. So it's always a 5-year proposition. They embedded, in addition to all of the money, so this funds housing production initiatives, tax credits, just a whole slew of housing-related items. And again, it's the single largest bond they've ever anticipated because the need is so great. So everyone is looking forward to this, hitting the ground and getting these different programs up and started. And they also put policy in there. So we're changing laws and things that the goal is make it easier for cities and towns. We have 351. They all have different zoning laws and ordinances, approval processes. That's what takes so long. So, for instance, accessory dwelling units. This is a topic that's been talked about for like a decade. This bond bill allows all communities, as of right is the phrase that's used, no matter how you're zoned, so single zoning, multifamily zoning, to develop ADUs, as they're called, accessory dwelling units. These are often used for aging parents. If you have an older adult child who may have aged out of services, turned 22 or more, that could be housed and stay with you in a dwelling unit on your property. The goal is to establish 8,000 ADUs or accessory dwelling units. In terms of housing overall, the goal is huge. 200,000. That's the goal. Yeah. It will take a lot to do that, but the bottom line is the state is putting an awful lot of money behind this now, and changing different laws and trying to develop policies because they realize it's impacting every segment. Extremely low income, even people that have some resources are challenged. We don't have enough housing, period, the end.
Yeah, and I think we also have to struggle with this idea that some communities don't want affordable housing in there. And we have a candidate, by the way, for presidency who's saying, I am going to stop the ability to insist on affordable housing.
Right.
We have another candidate, by the way, who is offering, I think it's $25,000 for first-time buyers. So it's on everybody's minds at the moment. When we think about community, you can't think about community without housing, right? Because you begin to get the breakdown of community itself. In some ways, it's a bit of a sad thing that we've got to get to such a difficult situation with people not being housed or living with their parents or living in rental situations, which, by the way, since COVID, rents have gone up to the point where a mortgage would be way cheaper for people if they could get one. But it's good to know that this is something that the State House people are paying attention to. Let's move on to education for a minute, because again, this is on everybody's mind. The Brockton school system has been in terrible trouble recently. The mayor has been called to book, and as of yesterday, I was reading that who knew about this overspend? I think it's up to 18 million.
I thought it was just on the radio as I came here.
That's a large amount of money. There's a lot of fingers being pointed, but it's emblematic of a bigger problem around education. What are we doing at the State House to address this issue?
Well, Peter, that's a great question. And similar to housing, I think the legislature probably hears from folks the most on housing, followed by education. The state puts an awful lot of funding, and I'll tell you about a couple of dedicated additional funds that are going to education right now. So the state, it uses federal funds, state funds under what's called Chapter 70, go to every city and town, right? Every municipality counts on these funds. In addition, we passed what was called the Fair Share Act, the FSA, and that imposed a 4% surtax on people making $1 million or more. That is now bringing in over $1 billion a year. It's far exceeding the projections. The state committed, as part of that ballot question and initiative, that the funds from this surtax would go two places: education and transportation. So about 500 plus million was dedicated of that first sloth to education. And not as much in the K-12 space, I will tell you, but in early education, in higher education, that's a lot of additional dollars. Those will keep coming in as long as that surtax keeps especially surpassing. So it goes into trust fund and gets appropriated out. That's one, and that's over and above the Chapter 70, okay? And then the next thing that the state did, recognizing that the Chapter 70 is a funding formula. People have always struggled with funding formulas, right? Are they fair? What about gateway cities that have more students from families of lower incomes, communities of color, etc.? So where is that equality factor? The state, it passed a $1.5 billion Student Opportunity Act that is funneling additional dollars, all pointed toward equity. And that is being spent over 7 years, again, in addition to the Chapter 70. So I think there's a big realization. And then we didn't even talk about transportation as a massive cost for all schools. So I think the state is trying to address it, dedicating funds toward it, but the problem is huge. And workforce challenges, shortages of teachers, support staff across the board, and inflation hit schools very hard post-COVID.
Occupational costs and things like that.
So you understand that.
Yeah, I totally do.
So the state is trying, and I think trying to recognize the needs of communities.
Yeah, and again, I'm proud to be a member of the Commonwealth that's actually identifying ways that they can address inequity, and education should not be I guess an accident of birth, which it tends to be. So I love the fact that we're looking this from an equity point of view. We talked about workforce a little bit, and we only have a minute or so left. But the other one, of course, is mental health and substance use disorder, which I'm obviously particularly interested in. We are finding it really, really difficult to find people who are properly qualified to deliver this service. Now, many of those people have sort of gone off and worked for these venture capital supported startups who are doing remote work for essentially what I would call the worried well. And in some of our communities of economic missed opportunity, we're not having those kind of services. What are we doing in that regard? I know that there was a bill in the Senate which is going nowhere, which would look to say, look, let's up those rates so that clinicians, so that we are competitive with other providers who are coming into our space. That didn't do so well, right?
Right. That bill went to a study, which, as we know, means it's not going further. So it's a kind way of saying that's as far as the bill is going to go this session. But the Commonwealth fully recognizes that even pre-COVID, but COVID hit everyone hard, especially our students and our very youngest residents of the Commonwealth, our kids. And so the state they took a bunch of the federal ARPA dollars, that American Recovery Plan Act dollars, and put them in a trust fund and are appropriating that out specifically toward substance use disorders and behavioral health. But as you said, and it's several hundred million coming through the budget each year, but it's the workforce crisis once again. We hate to say if there's a common theme that threads through all these issues we're talking about, it's resources are being dedicated. We can't find enough people, qualified clinicians. And that's why that bill that stalled is so important. If we don't raise the rates, then organizations like BAMSI and the folks doing incredible work, the mental health and behavioral health clinics across the Commonwealth, can't compete for the clinicians. So we've got to give them the resources they need.
We do. But we also have to be careful about what we ask for, because if we ask for far too much, it gets sent for study, right? And I think that might have been the problem with that this is not something that our legislators can, in good faith, commit to for the next generation coming through. But if we don't do that, then the next generation is really going to suffer. Maryann, we have run out of time, but as ever, thank you so much for enlightening us. And hopefully people just realize that it is wrong to be cynical about the political process. You know, democracy is messy, but it's better than any other form of government, right?
Absolutely. And as we talked about, a lot does happen. I think people just aren't aware, and it may happen a lot slower than we'd like. But again, get involved in the process, be persistent and patient, because it really pays off.
It pays off. Maryann Mulligan, thank you so much for coming in.
Thank you, Peter.
Thanks, everybody. Bye.